So oftentimes if someone's considering breast implants, probably part of getting a makeover, right? Well, what if somebody is in a weight loss program and really trying to lose a bunch of weight, but they want to get surgery? What would you suggest for them?
Well, I would say it's best for them to get close to their ideal weight. And the reason is measurements will change. When they come into the office, I measure them, their chest, their volume, so that when we look at pictures, we look at pictures of women similar to them, height, weight, frame, and shape. So the change really occurs mostly when there's about 10% of a body change.
Okay.
If somebody's 150 pounds and they want to get down to 125, well, that's more than 10%. So their measurements are going to change. So I would advise that patient get close to your ideal weight, less than 10% body change, and then we can actually go from there. Okay.
So if someone's interested in getting breast implants, and let's say a few years later they either gain or lose a significant amount of weight, how does that affect their implants?
It varies from patient to patient. So if a patient has implants and they gain some weight, then actually all of them might get bigger. And if they started fairly thin, it might look good. And there might not be anything necessary to do.
Okay.
So on the rare occasion, somebody puts on so much weight that they feel they look too big, and then they might want to go smaller. And maybe after years and years of having the implants, on the rarest occasion, somebody might say, remove the implant.
So weight gain or loss isn't really going to affect their implant, but certainly if they feel like the size and shape needs to be adjusted, that can happen.
Right. And also, if somebody loses a lot of weight, let's say they go into bodybuilding, they start converting their fat to muscle, well then, of course, they'll be smaller. They might lose some of the initial breast volume that they started with and feel that they're smaller, and their tissues will become thinner, and they might want to go a little bigger, and that's not uncommon to see either.